Alright, my name is Marissa, and this is my video for my medication insertion through a central line. So the first thing I'm going to do is I'm going to check my MAR or my order, and I'm going to note that my patient's name is Ron Smith, and he has allergies to morphine, and I'll double check his allergies once again later on once I'm in his room and when I'm grabbing the medication. Looking at my scenario, he was admitted for pneumonia secondary to lung cancer. He has a double lumen PICC in place, and it's used for intermittent chemotherapy. So this would be checking to make sure that he has appropriate use for this PICC line to be in place. Other reasons for people that have central lines would be like somebody that's getting long-term antibiotics or somebody that's on dialysis. So he's okay to have this. His PICC line is currently saline locked, and he is reporting anxiety and rates his chest wall pain at a 2 out of 10. His PICC line dressing is also due to be changed. So based on priority, I'm going to go ahead and I'm going to check his orders and his MAR to make sure that he does have a medication to be given for his anxiety. And checking his MAR, he does have lorazepam 1 milligram IV push every 4 hours PRN for anxiety to be given, and it is okay to give it at this time. It's past the 4 hours mark. So I'm going to go ahead and I'm going to gather my supplies. So my supplies that I'm going to gather is the lorazepam itself, and I can go ahead and check and see that the expiration date is 12/20/30, so it is not expired, and that I'm going to be giving it for Ron Smith every 4 hours for anxiety, and it is okay to give. He has allergies to morphine that I know, and so it is okay to go ahead and give the lorazepam. Other supplies that I'm going, and I'll get dose accurate in a minute with this. Other supplies that I'm going to gather are 3 10 ml syringes full of saline, VAD, some tape, what I'm actually going to use for labeling when I dilute my solution, some gloves, hand sanitizer, watch, alcohol swabs, and I also have a watch on, so I'll just use this for this video. So then I'm going to go ahead and I'm going to get dose accurate here then. Well, actually, before I do dose accurate, I got to do my math. So looking at my math, this is 2 milligrams and 3 mLs, and I need to give 1 milligram. So doing my math, I figured out that I have to give 1.5 milliliters for my dose. And then I also figured out how often I'm supposed to, or how long I'm supposed to give this medication over. So per this book that I looked it up in, 2 milligrams is supposed to be given over 1 to 5 minutes. So play on the safe side. I did the math with the 5 minutes, and I'm doing it for 1 milligram, which is my dose that's ordered. So I need to be giving this dose 2.5 minutes, over 2.5 minutes. I also checked my dilution, and in this book, and it says that my dilution should be my saline should be equal to the amount of medication that I'm giving. So again, I'm giving 1.5 mLs, so I'm going to be diluting it in 1.5 mLs of saline. When I did this, I also checked my compatibility, and it is okay to give my lorazepam in normal saline. If he had an IV hooked up, I would, or any other medication or anything running, I would check and make sure everything was compatible to be given at that time, but he doesn't. He has a saline lock, so it's okay to get. So I'm going to go ahead and I'm going to get dose accurate here. Again, I'm doing 1.5 mLs of this lorazepam.
Need to check that the central line French is
Alright. So then on here, I have 1.5 mLs. I'm actually going to go a little bit further here. Make sure I'm dose accurate. Alright, so then this is 1.5 mLs of my lorazepam, making sure that I'm dose accurate. So once I am dose accurate, I'm going to go ahead and I'm going to do my 3 checks then on my MAR. So I have Ron Smith, who's getting lorazepam 1 milligram. So 1 milligram after doing my math is 1.5 milliliters. So 1.5 milliliters every 4 hours PRN for anxiety, and it's okay to give so now. So again, I have Ron Smith, and I'm giving 1 milligram IV push. So 1 milligram, doing my math, is 1.5 milliliters. It's 1.5 milliliters, and I'm giving it every 4 hours PRN for anxiety. It's okay to give so now. One more time, I got Ron Smith, and he has lorazepam 1 milligram IV push every 4 hours PRN. So I'm going to check my chart, or when I did my math, I get 1.5 milliliters every 4 hours PRN for anxiety, and again, it's okay to do so. So once I am dose accurate then, and I did my 3 med checks, I'm going to go ahead and outside the room, I'm going to wash my hands. There it goes. Alright, so I'm going to go ahead and wash my hands. I'm going to have my stuff and knock, 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 and I'm going to provide for some privacy right away. So once you come in the room, hi Ron, my name is Marissa and I'm a student nurse, and I'm going to be doing or giving you some medication through your PICC line here. Before we get started with anything, can you tell me your name and date of birth? And he says his name is Ron Smith and his date of birth is 2/19/1955. I'll check the wristband and it says Ron Smith, 2/19/1955. And I'll say, okay, Ron, I have that you have some allergies to morphine. Is there any other allergies that we don't know about? And he says, no, just the allergies to morphine. And I'll say, okay, so what I have the medication to give you today is the lorazepam for your anxiety that you're experiencing. And he says, okay. And I said, have you ever had lorazepam given through your PICC line before? And he says, yes, he has. And I said, okay, so you understand that this can cause a little bit of drowsiness or sleepiness, and yep, he understands. So then I'm going to go ahead and I'm going to get my supplies ready here. So I'm going to get all the air out of my saline flushes. Alright, and my last one. And for my last one here, right away, going back to my dilution that I figured out that I need to give this in 1.5 milliliters of saline, I'm going to go ahead and make this 1.5 milliliters of saline. This one has a big air bubble in it, so I'm actually just going to grab a new flush here right away. And I'm going to get this down to 1.5. So that's 2, 4. So I need it right between 1, 2, 3. There we go. So this is 1.5 of saline solution. So while you're checking that, I am going to go ahead and I'm going to connect my dose accurate medication to the VAD device, and then I'm going to take my cover off of my 1.5 saline, and I'm going to insert that in to dilute my medication. Make sure there's no air bubbles. I'm going to recap for now. Then I'm going to bring everything closer. And then I'm going to put some gloves on here right away. Oh, before I do that, actually, now that I have this diluted, to make sure I know what one is diluted, I'm going to take my tape and I'm going to make a label out of it here. I'm going to label that it's 1 milligram of lorazepam in 1.5 mLs. It is the dose, and that it is in normal saline. So I'm going to ahead and I label that. Then I'm going to go ahead and put my gloves on here. And then when I go put my gloves on, I'm going to assess my arm right away. And when I'm assessing my arm, I'm assessing for infection, infiltration, and dislodgement of the PICC line. So I'm going to go ahead and just palpate around, and everything looks good. There seems to be no signs of that. So I'm okay. So then I'm going to go ahead and I'm going to use my alcohol swab here. And when I'm cleaning that end here. I'm going to be doing it based on agency policy, however long they say that is. For this case, I'm just going to do 15 to 30 seconds. Alright, once 15 to 30 seconds is over, I'm going to take my first flush here and I'm going to connect it. I'm going to unlock or unclamp my PICC line and I'm going to slowly flush.
My name is Rachel, and this is my video for drawing blood from the central lines. I check my mark.
Alright, and then once my flush is done here, I'm going to go ahead and reclamp my PICC here.
I would check for allergies.
Alright, and then I can disconnect this. And then I'm going to go ahead and I'm going to grab another alcohol wipe. So now the next one I'm going to be doing is the one that has my lorazepam medication in it. And again, looking in the book and doing my math, it should be given over 2.5 minutes. So when I'm doing this, I'm going to be looking at my watch and making sure that I'm giving it over the 2.5 minutes. I'm going to unclamp it first and then make sure I'm giving it over the 2.5 minutes. And then say the 2.5 minutes is done and all my medication is in. Then I'm going to go ahead and I'm going to reclamp. And I'm going to disconnect this. And then I'm going to be doing my last flush. So when I'm doing my last flush, I'm going to be doing the first 30 seconds of my flush at the same rate of the medication that I just administered. And then for the rest of it, since it is on a PICC line, I need to be giving the flush in a pulsating flushing motion. So again, connect, unclamp, and the first 30 seconds I'm going to be doing it the same rate. And then after the 30 seconds, I would do it in a pulsating motion until my flush is gone. Alright, and then I'm going to reclamp. And I'm going to disconnect. And then when I'm all finished here, I would just dispose of my supplies. I would ensure patient safety by putting the bed down. Oh, I would take off my gloves before that too. When I was done, I would take off my dirty gloves and then I would ensure patient safety, putting the bed down, the side rails up, and the call light in place, and my supplies, get rid of those. And then I would, for a lifespan modification, would be if this was a child, I would make sure, or try to have a parent in the room to make sure that the child's not moving while I'm administering this medication. And then after that, I would wash my hands, and then I would go out and document my medication that I just gave at the time and how the patient tolerated it.